But I want to take us back to January of 2021. I know it's hard to recall the sense of real fear during the worst of the pandemic. More than 20,000 Americans died from coronavirus each week. And we were looking to some way to stop the spread and the deep-seated pervasive fear. During the worst of the pandemic, more than 20,000 Americans died from coronavirus each week.
A man dies in a motorcycle crash, but his death listed as a coronavirus death.
Illinois' virus-related death toll continues to climb. The director of public health took time today to explain how the department rules someone an actual COVID death. It can be a little confusing.
Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So
a 90-year-old man who fell and died from complications of a hip fracture. A 60-year-old man dead from a gunshot wound to the head. These are some of the deaths in Palm Beach County recently and incorrectly labeled as COVID deaths in medical examiner records.
According to the CDC themselves, of the 220,000 deaths attributed to the coronavirus, 87,000 of them died from pneumonia and influenza. Another 17,000 died from chronic respiratory diseases, and 26,000 died from respiratory distress syndrome. 44,000 patients died from hypertensive diseases, 23,000 died from heart disease, and a whopping 28,000 died from cardiac arrest and heart failure. Yet all of these, even patients who died from heart attacks, were marked down as dying from coronavirus.
I mean, let's just take someone getting hit by a bus and they collapse along and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
So I have some examples here, and I was shocked, Scott, to find this. Seriously shocked. So we have an auto accident. The passenger was ejected from the vehicle, but there was COVID in the system, so therefore it counted as a COVID death.
But in Milwaukee, per the medical examiner, every person who dies with COVID-19 dies from COVID-19, no matter how sick they already were. Shannon?
Wait, did you say people who weren't even tested for COVID-19 had that listed as their cause of death?
If the doctors thought they had symptoms of COVID, they listed COVID as the cause of death.
Okay.
But I want to take us back to January of 2021. I know it's hard to recall the sense of real fear, the deep-seated pervasive fear.
My heart is sinking right now as you're telling me this. You're a doctor. Why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough.